Welcome to panel 2, everyone, BPD Treatment Supporting Recovery. We are so happy that you guys could join us today. Nikki and I will be moderating the panel as a volunteer from Emotions Matter. While I'm doing the introductions, we invite you guys to write in the chat where you are joining us from today. I'm coming from Boston, Massachusetts. All right, let's see. Emotions Matter is a 501c3 nonprofit organization founded in 2015 to support, educate, and advocate for those impacted by borderline personality disorder. To learn more about us and our programs, go to our website, www.emotionsmatterbpd.org, or head to the expo. Emotions Matter strives to create a safe, judgment-free space for people with borderline personality disorder. We expect that there is a spectrum of experiences within the BPD community. We honor where people are on their journey without judgment or assumptions. We encourage people to define their own path toward recovery, and we speak as experts of our own lived experience and not as medical experts. Community guidelines. 1, questions during sessions should be asked using the Q&A box, not the chat. Comments can be made in the chat box. Please use respectful language in the session chat. Any inappropriate messaging, including harassment, bullying, or monopolizing the chat, will be deleted. We accept differences and promote acceptance, especially with regard to gender, sexual orientation, identity, race, ethnicity, age, religion, disability, or politics. Avoid explicit expressions of self-harm or trauma, which may be upsetting to others. And panels and plenary sessions will be recorded and available after the conference. So please no screenshotting or recording on personal devices. Some safety guidelines, a little bit of a disclaimer. If at any time during BPD Fest 2024, you find yourself to be overwhelmed, struggling, or for any reason in need of support, we encourage you to reach out to your support systems. Audience members may experience intense and painful emotions, feelings, memories, thoughts, and/or reactions to the content shared, so please participate at your own risk. You're also welcome to take a break from BPD Fest at any time or withdraw from it entirely. And in the event of a medical, including mental health emergency, please seek care through a doctor, hospital, or emergency call number. All right. At this time, I'd like to introduce our panelists. Dr. Benjamin Johnson is an assistant professor in the School of Psychiatry and Counseling at Fairleigh Dickinson University. He received his Ph.D. in clinical psychology from the Pennsylvania State University. He runs the Treatment and Assessment of Personality Pathology TAP lab at FDU, which studies how personality, relationships, and the experience of trauma influence how people manage difficult emotions. His research has specifically focused on better understanding and treating borderline personality disorder, suicide, and self-harm. And our second panelist, Alexandra Stein, is a doctoral candidate in clinical psychology at Fairleigh Dickinson University and a member of the Treatment and Assessment Personality Pathology TAP lab at FDU, where she is currently conducting research on the BPD favorite person under the mentorship of Dr. Benjamin Johnson. Alex is passionate about contributing to a deeper understanding of BPD through research on the lived experience and providing treatment to individuals with BPD and other personality disorders. As an Emotions Matter board member and cast of the BPD Bunch, she considers BPD advocacy a crucial part of her work and her own life worth living. Thank you so much, Dr. Johnson and Alex, for speaking today. I will hand it over to you guys.
Great, thank you so much, Kimberly. Definitely appreciate the introductions, and hi, everyone. I'll go ahead and share our slides here. All right, hopefully that looks okay. Alex, you can see that okay?
Yep.
All right. Okay, so today we'll be kind of continuing the conversation about recovery from BPD and kind of some ways that we've been thinking about recovery outside of the therapy office or outside of the context of formal therapy. Alex and I will kind of go back and forth, I think, throughout this presentation and kind of dialogue a little bit as we go. and hopefully leave enough time for some good discussion and Q&A at the end. So please ask any questions that you have in the Q&A, and we'll try to answer them either during or at the end of the presentation. Right. So just a little bit of a kind of overview of what we'll be covering in our talk. It's kind of three different areas. We're going to start by giving a sense from a combination of kind of the treatment literature as well as, you know, our own experiences or work with our patients about areas to think about when thinking about recovery from BPD, kind of general domains of recovery. Then we'll overview some of the main treatments that exist out there, particularly the ones that have been supported by a number of different studies or controlled trials. But then also think about how to adapt some of these treatment principles outside of the therapy context in your everyday life. And finally, give some general principles or thoughts about both seeking therapy or other services and support, but also really ways to optimize recovery in your everyday life in kind of a broader or global sense. So just to kind of overview the main domains of thinking about recovery that we're going to focus on and kind of tie to the treatments that we're going to be talking about. We've kind of outlined these three general areas that include your emotions and thinking about emotional regulation or emotional experience. We'll talk a little bit more about that in a second. We'll also talk about identity and sense of self as a really important aspect of recovery and kind of both living a life worth living and having kind of a fulfilling experience of yourself in the world. And then we'll talk obviously about relationships and relationship health and satisfaction and finding fulfillment in relationships.
All right, so for emotion regulation, we thought of a number of different things that might kind of signify what it would look like in BPD recovery. So kind of things, maybe goals to have, things to keep in mind that might signify that you're getting better at regulating your emotions. I think the first one would be just knowing what you're feeling, being able to name and identify the feeling that you're having. And then also being able to tolerate it. I mean, feelings can be extremely painful, and especially when they're very painful, they're difficult to tolerate, but being able to sit through and just, you know, kind of endure that emotion until it goes away. And not immediately acting on your feelings. So not engaging what we call mood-dependent behavior. Instead, keeping your long-term goals in mind and really acting in line with those. And then also being able to change what you feel. So doing a number of different things that might change your emotion, might, like, you know, change the intensity of the emotion, maybe might lift the feeling of depression or lower the intensity of anxiety or anger. Also decreasing your vulnerability to these intense emotions, which is very important. And being able to reflect also on what other people are feeling without jumping to conclusions, which can often happen with BPD.
When thinking about kind of one's identity or sense of self in the context of recovery from BPD, we also kind of had a couple different thoughts about, you know, ways to think about this and keep this in mind when either in or out of therapy. Some of the things that we think are kind of really relevant are kind of really knowing who you are or who you aren't, and kind of the things that you like or don't want for yourself in your life as an important part of your sense of self. And also having a clear and consistent sense of yourself over time, so that, you know, from moment to moment or week to week, you kind of know who you are, and it's kind of more stable and consistent over time as an important part of one's identity. Related to this, also having a kind of both an accurate sense of yourself, but also a positive or healthy self-worth or self-esteem, recognizing your values and strengths and the things that you contribute to the world or to your relationships or to yourself. When understanding yourself more clearly often can make it easier to know what your values or goals are in your life. That's an important part of identity as well. And being able to kind of pursue those and make steps towards your goals or your values in terms of work or relationships or other kind of recreational activities that kind of feel good to you and kind of fit with who you are as a person. Also related to this sense of yourself is also understanding how you are similar or different to people in your life, knowing what makes you unique, ways in which you do connect with other people, or things that make you kind of different or special in relation to other people who may not have certain strengths that you have as an individual. Also, we'll talk a little bit more about this too when we talk about some of the treatment approaches, but an important part of kind of having a whole and healthy identity is being able to tolerate, accept, and recognize all of the aspects of yourself, both the good and the bad, the strengths and the weaknesses, being able to kind of tolerate and hold on to both sides. And sometimes it's more difficult for people to hold on to and remember their own strengths rather than their weaknesses, or vice versa. But being able to hold on to both of these is very important. And finally, being able to tolerate uncertainty, the inevitable moments where things are confusing and uncertain, being able to kind of tolerate those and get through those successfully is an important part of identity as well.
All right, and then the last domain we're talking about is relationships. So I think we really see recovery as being able to open up to people and find closeness, vulnerability, being able to trust others, being able to set boundaries with others and really assert those in your relationship. And at the same time, communicate your needs and your feelings, your thoughts effectively to another person. Also being able to tolerate when you don't get what you want from other people, or tolerating other people's feelings towards you if they're negative. Letting go of the desire to control other people's feelings or their thoughts or their behavior, which can feel really difficult when it's painful to you. Also not relying on other people to be kind of an external emotional regulator. So being able to do it yourself and not completely relying on others to do that. Being able to maintain stable and meaningful relationships over time that last. And to be able to work through conflict relatedly without a fear of abandonment, without jumping ship, or without doing anything that might end up being a self-fulfilling prophecy and leading to the end of a relationship.
So we've kind of overviewed some of the general domains of recovery that we're going to try to touch on when we talk about various treatment approaches. So the next kind of step in what we'd like to talk about today is some of the existing empirically supported research treatments that are out there. There's actually a large number of treatments for BPD, and all of these have received some, research behind them. A lot of the treatments come from these kind of two general different approaches. One is sometimes referred to as a psychodynamic approach, which tends to be more about exploration and kind of getting to know yourself through discussion in the therapy setting. And then other treatments have a more structured or skills-based or more cognitive behavioral approach, where you might learn strategies to deal with difficult emotions, ways to think more effectively about what's going on for you. And we'll kind of touch on some of the treatments here, really the ones that I have highlighted now, that really have the most research that's been done on them. They're often the most widely available, although we'll talk about ways in which these treatments are often not available. We'll give you kind of an overview of these treatments and then talk specifically about ways to apply some of the principles from these approaches into your everyday life, even if you're not able to be in any type of treatment of this type.
All right, so let's get started with DBT, dialectical behavior therapy. So the theory behind DBT, aside from the fact it's a cognitive behavioral based treatment, meaning that, it really focuses on changing behaviors and also thoughts as well in order to change emotions. It's also really rooted in a dialectical viewpoint, the idea of dialectics, which is the balance between acceptance and change. So accepting where you are and also changing, working to change things. It's also rooted in the biosocial theory, which is really looks at BPD as being a result of a biological vulnerability to emotional sensitivity, and which also interacts with an invalidating environment in early life, leading to the different BPD symptoms. So really the goal of treatment is to change these often dysfunctional patterns of behavior, of feeling, of thinking, and relating to other people, and really move yourself towards a life where you feel in control and in a life that feels worth living to you. So in this treatment, it involves a number of different skills. The first and foremost, it involves skills training. It also, through treatment, at the beginning of treatment, you would come up with your therapist of a number of different target behaviors, kind of in order of the importance of them, or the danger of them, and how important it is to get rid of these target behaviors. So you really have a very clear target of things that you want to work on. You're also given a diary card that you fill out every day to track your emotions, to track your urges, to track behaviors that you've engaged in. And then you usually can come back to treatment and do something called a chain analysis, which is really going through step by step everything that happened that led up to engaging in a target behavior. So this is going through what happened before, what was the vulnerabilities to this, what was your thought, what was your feeling, and then, the behavior itself. Eventually learning to replace the behavior with a more effective one. There's also active therapeutic collaboration between therapist and patient. Patients and therapists really work together. It's not just the patient working on their own. I mean, the patient has to be willing to do the work, but with the therapist figuring out what the goals are, figuring out what skills to use when, and really trying to work together as a team to help a person get better. So there's different formats that you can do DBT. I'm going to talk a little bit mostly about what we call standard DBT, which involves individual therapy sessions, group skills training, and phone coaching outside of therapy. But it is possible to, do a individual therapy with a DBT therapist who teaches you skills and goes over some of these things with you, or just to do a group skills training. So typically what we call a round of DBT. So to get through the whole cycle of all the skills usually takes about 6 months to a year. And then you have weekly individual sessions during that time or groups, but there also are other formats. I've seen places where it's 5 days a week group. It's more of an accelerated program. So they have different programs that do different things, but DBT as it was created is really meant to have weekly individual sessions and group sessions. And so I just quickly want to go through what the skills are. In skills training, we have 4 different, Ben, if you could go back. So we have 4 different modules that are taught through skills training. The first one being mindfulness. We have emotion regulation skills, interpersonal effectiveness skills, and then distress tolerance skills. And we really see mindfulness and distress tolerance as the skills that are more the acceptance skills, and emotion regulation and interpersonal effectiveness being the skills that are more change oriented. So to touch a little bit more again on the different DBT treatment modes. So you have individual psychotherapy, you have skills training, between sessions, phone coaching, and then there's also a therapist consultation team. And the purpose of this is that, we want to make sure that we as therapists are giving the best treatment that we possibly can. So being in the group and being, held accountable by others, and, always just trying to make sure that you are the most effective DBT therapist as possible so that the patient can get the best treatment possible. So when we talk about standard DBT, it has all of these components, all of these different treatment modes. There's also you can do standalone DBT skills training. Like I said earlier, you can also do an individual therapy where maybe the therapist teaches you DBT skills. And I do think that this is still effective. There is something about the standard DBT though, that involves all of them, all of these different components that really helps you to increase your motivation for change. It helps you to generalize your skills outside of therapy. And it really helps facilitate the change in someone's effectiveness itself. So how can you learn DBT skills without doing DBT? Because being able to do a DBT group is amazing. And it's honestly a privilege. It is something that's sometimes difficult to find. It can be extremely expensive. But DBT skills are very helpful. These are tangible things you can do in life to help, reduce symptoms. Luckily, there's a number of different ways that you can learn DBT skills without actually fully doing DBT. My suggestion would first and foremost to be, if you don't have access to DBT, to go and purchase the DBT handouts and worksheets, the official ones from Marshall Linehan. I think they're on Amazon or anywhere else online. And really to have those as you do other things and to be able to go through. So you can also do workbooks. There's a really great book called the Dialectical Behavioral Therapy Skills Workbook. There's also another book that came out about, I think, last summer, that's Self-Directed DBT Skills. That's a 3-month DBT workbook. And these are, things that you have to do yourself. So you have to find someone to hold you accountable or really keep yourself accountable. Because when you're in treatment, you have a therapist to, even do a chain analysis for why you didn't do your homework. So it's hard when you don't have that piece. So it really has to be very self-driven. So having the accountability from someone else can also be really helpful. Something I've told people would also be really helpful before is looking at podcasts. So there's a number of different podcasts that go through the different DBT skills. And I almost see them as almost like a skills group session. Like you can close your eyes and imagine that you're actually in a skills group. This is why I think getting the handouts and worksheets can be really helpful, because you can go along with these podcasts as if you're in a skills group, and complete the worksheets and the handouts as you go along. So 2 of these that I think are good ones are DBT and Me, and also Therapists in the Wild. There's also YouTube videos that talk about different DBT skills and how to do them, less full group session kind of format, but you can learn about different DBT skills and learn how to implement them. One of these YouTube channels is the DBT Rutgers University channel, and then Psychotherapy Academy. And the last thing I'll say about this is DBT requires practice, practice, practice. And that, again, is the main benefit of being in a full model DBT program, where you have so much, you have accountability, a lot of accountability to do your homework, to practice, to generalize these skills. So if this is something that you don't have access to, really just try to make sure to practice as much as possible.
As we keep going, I just want to, point out again that one of the things that we hope is helpful in this is that you can start to see that there's a range of treatment options out there. And some treatments might align better with your own kind of interests or who you are as a person better than others. So as we're going through these various treatments, think about kind of what approach might be well suited to your, own kind of needs. And that if you're kind of seeking one of these more specialized treatments, you might seek out one that kind of fits with what it is you think would be most helpful for you, because each treatment has a kind of a different stance or a different approach. Also, I don't know that we mentioned this as well, but these slides, I believe, will be made available too, so you can have this information, after the presentation or after BPD Fest, in case that's helpful to you as well. So the second kind of specialized treatment that we wanted to talk briefly about is mentalization-based treatment, which is a more psychodynamic or kind of interpersonal exploration type treatment compared to a more structured treatment like DBT. MBT is really rooted in writing and theory about something that is kind of theory of attachment, which is an approach that really describes how we relate to people who we're close to, like our parents or our friends or romantic partners, and learn about ourselves and learn about relationships via those kind of early experiences in our with our attachment figures. MBT really tries to target the specific experience or process called mentalizing or mentalization, which refers to our capacity to make sense of our own thoughts and feelings and other people's thoughts and feelings, as well as to know ways in which our own thoughts and feelings might be different from other people's. So this capacity to mentalize, to reflect on how I'm feeling right now, how another person might be thinking or feeling right now, and to do that in a relatively accurate way, is something that we learn in our relationships as we grow up. And yet in some cases, we don't have the opportunity to really learn that process of being able to kind of understand how other people might feel towards us. And this might lead, in the context of BPD, towards moments when we think other people don't like us, when really that may not be the case, right? So this capacity to understand other people's thoughts or feelings towards us, or at least to be open to various ways other people might feel towards us that aren't just negative or aren't just one-dimensional, is really what MBT focuses on trying to improve in patients. Some of the ways that MBT does this, MBT takes both an individual therapy and group therapy component. And so to do kind of full model MBT, you usually would have an individual therapist as well as be part of an MBT group. And in both of those situations, a lot of the work is on practicing trying to reflect on or mentalize your own thoughts and feelings in a given moment, your therapist's thoughts or feelings, why they might be saying certain things to you, or how they might think about what's going on in your therapy relationship, and also other people's in the group context. You might be sitting with 6 other people in a group, and an MBT therapist, might say, you just said XYZ. How do you think so-and-so feels about what you just said? And then the therapist might ask the other person, how did you actually feel about what the first person said? And you kind of get to practice this process of thinking about and reflecting on the experience that we each have in our mind and how they might be similar or different to other people's experience of the same situation. A therapist practicing MBT often takes what's called a not knowing stance, which is really this kind of stance of not being the expert, of actually taking a step back and allowing patients to really do the work of reflecting on what the patient might be experiencing or thinking in a given moment. So a therapist in MBT isn't going to come in and say, oh, I think you said that because you feel X or you feel Y. It's really up to the patient in this approach to try to do that work of, I think I might have said this because I was feeling sad at the time, and that's why I said this thing to my friend. So there's lots of kind of this exploration in the context of relationships in this approach. A full model MBT is usually about a year to a year and a half with both these kind of individual and group components, although sometimes there are other settings in which MBT is done. Sometimes in hospitals, actually, in inpatient units, sometimes you can, particularly in the UK, this is more popular. You can find MBT in those settings as well, instead of just in outpatient settings. One of the things I think is interesting about MBT is, as I mentioned, it's based on this idea of attachment. And if, not to go too much into the idea of attachment, but you may be familiar with the idea of attachment styles. And this figure here just represents 4 of the kind of typical attachment styles that we might have in relationships, ranging from secure attachment, which usually reflects an ability to both open up and trust other people, but also an ability to have our own independent lives and interests and sense of self. And there's a range of other attachment styles that tend to lead to more difficulties or distress in our relationships. And one thing I wanted to point out that you can see in this kind of image here, that this is information from one specific individual who has different attachment styles in different relationships. And so often, even though you might hear this term of, oh, I'm anxiously attached or I'm insecurely attached, what we find in an attachment-based therapy or approach is that people have different ways of relating to different people in their life, right? I might have a secure attachment with my romantic partner and I can open up to them and I can trust them. But with my parents, it's really difficult for me to open up to them or be vulnerable. And so one of the things that we'll talk in a moment about is being able to understand your own attachment styles and how they might differ across your relationships can be a useful way to apply some of this thinking about understanding yourself in the context of other people, reflecting on how you might struggle with mentalizing in certain relationships and not others, can be an important thing that you can get into without actually being in MBT. So some ways to do this type of MBT principles in your everyday life without actually being in an MBT therapy, if you don't have access to that, can be as simple as practicing this process of asking yourself or others how they're thinking or feeling about certain things. Right? So often we jump to these conclusions about, I come home and my partner, is upset that I'm 10 minutes late. And I automatically think that I've let them down somehow, or I've disappointed them, or somehow I've failed. And instead of kind of jumping to that conclusion, I can pause and ask my partner, what's going on? What you seem like you're upset. Tell me what's going through your mind right now. And that process of practicing mentalizing or reflecting on the other person's thoughts or feelings can be a really useful technique that you can kind of take with you in everyday life and start to challenge some of these assumptions you have about what other people might think about you or what you might think about yourself. Related to this idea of different attachment styles, there are online, and here's one example of this, different questionnaires that you can complete that will actually give you information about your own attachment styles. So the way in which you might be more anxiously attached towards people, where you tend to really want to be very close to them, and it's very difficult to kind of have alone time. Or maybe more avoidantly attached, where it's hard to be open up with people and be intimate with other people. You can get a sense of your own attachment style across the different relationships in your life by filling out one of these types of surveys or questionnaires. And for instance, this link here will give you information about your attachment styles across different relationships in your life. That might give you a sense of what types of specific relationships you struggle the most with mentalizing, with reflecting on the other person's thoughts or feelings towards you. And that could at least give you kind of a target for doing this type of work, of asking yourself or asking that person, how are we right now? Like, something feels off, but I don't want to jump to conclusions. Are we okay? Let's talk about it. This can give you kind of an in to figure out which relationships might be most important to do that work with. And again, this info will be shared, and so you'll have this link if you want to jump to it after after BPD Fest. Another treatment that comes from a psychodynamic or exploratory background is something called transference-focused psychotherapy, which I'll also touch on here. So transference-focused psychotherapy, or TFP, really focuses on identity. So we mentioned earlier that identity is one of those kind of big domains that we think is relevant for recovery. TFP really targets that aspect of our experience. Focuses on our understanding of ourselves, the ability to have nuanced and complex understandings of ourselves, with both ability to accept the good parts of ourselves and the bad parts, and being able to hold on to those and recognize that we're three-dimensional people, and to be able to tolerate all of those aspects of ourselves. It's often very difficult to accept some of the negative parts of ourselves, or even some of the positive parts of ourselves, and TFP really targets and focuses on that process in therapy. So some of the techniques, which I'll talk about in a moment, in TFP, that if you were in this treatment you would experience, really help patients to think about and explore the different parts of themselves, to spend time talking about parts of themselves they like, parts of themselves that they don't like, kind of trying to bring those into conversation at the same time. And then the therapist will at times help patients in this approach to kind of move a step deeper in understanding yourself, right? Maybe you're somebody who tends to avoid socializing, or it's really hard for you to go out in kind of a unstructured social setting. A therapist in TFPs might help you understand what it is you might be afraid of in those situations, what it is you might be protecting yourself from by staying out of social situations, and kind of having a deeper understanding of yourself in that way. TFP's format is usually solely individual therapy, although often most of the time the therapy will happen twice a week. So you might have 2 individual sessions a week in a formal TFP. Doesn't have a group component, so most of the work is done with you and a therapist in this approach. And in general, again, kind of the full model TFP takes about a year at minimum, sometimes longer than that, in part because it takes a lot of time often to understand kind of all of the different layers to ourselves and the different ways in which we're potentially avoiding coming to terms with some parts of ourselves that are uncomfortable. So just as a little bit of overview of some of the techniques that you would see in a TFP therapy, there's really kind of 3 techniques. I'll just touch briefly on each of them that a therapist doing TFP would use. The first and most common technique that is used in this approach is called clarification, which basically means that your therapist would just be asking you questions about your experience of the world, your experience of yourself, your experience of the therapy. And often that's actually one of the focuses in this approach, is you'll talk about the therapy and the therapy relationship itself very often in this approach. So a therapist might ask you, what is it like to tell me this, story of this experience that you had? Maybe you've experienced some form of trauma in your life, and you're talking about it with your therapist. A TFP therapist is going to ask you, what is it like to talk about this? How is it to share this with another person in this context? The second technique that will come up in this approach is called confrontation. That may sound like argumentative, but really what this approach or this technique refers to is when the therapist really tries to help the patient to grapple with competing or seemingly contradictory parts of yourself, right? So maybe a patient in this approach says that they feel worthless very often. And then one day they come in, they got a new job, and they feel proud of themselves for having gotten that job. A therapist might help the patient to explore how you said you feel worthless, but you also described feeling proud of yourself right now. So let's talk about those two signs of you, right? Feeling worthless suggests you have nothing to give, but you feel proud that you got a job. So clearly you have something to give. Let's talk about those two aspects of yourself, with the goal being to help the patient to really understand there's more to me than just worthlessness. I actually do have some strengths and values, even though sometimes I also struggle with other, ways in which my self-esteem might be negative. And then finally, the last technique that a therapist might use in this approach is called interpretation, which is really those moments, and they may not happen very often in the therapy, but those moments when the therapist really tries to help you uncover deeper layers of who you are, or ways in which you're kind of protecting yourself from uncomfortable experiences or uncomfortable parts of yourself in your life. So for instance, a therapist might say that you've been protecting yourself against the fear of disappointing people by being convinced that you have nothing to give, right? Maybe this worthlessness that you carry with you is in some way protecting you from taking the risk of putting yourself out there and having somebody else maybe not like you or say something negative about you. So the therapist might help you to kind of uncover that deeper layer of that worthlessness that you feel and the ways in which it might actually be protecting you from something even scarier, like other people's rejection or other people thinking that we're worthless. So some ways to think about applying these principles in your everyday life, in case you don't have access to a TFP therapist, or it's not something that you have the resources for, and we'll talk about some of those limitations in a moment, are you can do some of this work on your own by journaling or diarying about some of the strengths and weaknesses that you might have yourself. So you can make a list of some of the strengths that you have and the weaknesses you have, and notice which of these is harder to write. Is it difficult to identify strengths that I have? Maybe that's an area I need to focus, is really paying attention to the moments I actually do something successfully, or moments I do feel good about myself, and trying to add those to my list, my kind of repertoire of who I am as a person. You can do this with journaling on days when you don't feel so good and days when you do feel good, and comparing those, seeing, do I feel like a different person on days when I feel bad versus days when I feel good? How do I put those together? And finally, you can kind of ask yourself or think about ways in which what you're doing for your work or your relationships does or doesn't align with who you want to be as a person. Are there ways in which your values don't really align with the people that you're spending time with? And start to kind of be curious about ways in which you might kind of find yourself in work or relationships that don't align with your values.
All right, so now we're going to talk about schema therapy, which is also called schema-focused therapy. And this is really a very integrative cognitive behavioral treatment that really views that there are certain maladaptive schemas. Schemas are core beliefs that we have about ourselves, others, and the world that are developed in response to early unmet emotional needs. And schemas really drive our patterns of thinking and feeling and behaving, and can characterize the symptoms of BPD often. So the goal in treatment here is really to identify which schemas that you tend to have, and to change them or to heal these maladaptive schemas and develop new, healthier schemas. So in schema therapy, we also talk about schema modes. Schema modes are certain kind of patterns of thinking and behaving and feeling that arise in response to specific situations. And with BPD, you might have a number of different modes activated at once or in conflict with one another. So the different techniques that are kind of used to manage these things and to move yourself to what we call like the healthy adult mode is, well, first of all, the therapist does something called limited reparenting. It's something that's different from other therapies, where the therapist, really allows themselves to almost act as if they're the patient's parent. Obviously, they're not actually the parent, but parenting them in a way where they can develop healthier schemas, healthier beliefs about themselves and about others. There's a number of emotional techniques to increase emotions or to create contact with emotions, or experiential techniques. This can be something like imagery and rescripting of imagery. So imagining experiences that have happened in your life before, maybe going through it and kind of rewriting the script. There's a lot of role play with your therapist. You might be, role playing a difficult situation you had during childhood. There's also cognitive techniques, one of which is Socratic dialogue, which is the purpose of that is really to kind of help the patient discover that there's more than one possible interpretation for a situation. It asks a lot of questions of a patient to really get them thinking about how else they might interpret a situation. Patients can also make flashcards for different schema modes that pop up. So maybe on one side of the flashcard, they write, from the viewpoint of that schema, and on the other side, they write a new view, something that's a little bit more balanced or nuanced. And then lastly, there's behavioral techniques. So there's things like behavioral experiments where you kind of, decide to do something, and the experiment is to see what you expect to occur, whether or not it actually happens. So having someone go out and do something maybe they're afraid of doing, and seeing, well, I guess from the experiment, they might learn, well, that's not actually going to happen, or that didn't actually happen. My fear didn't actually occur. Then there's also social skills training to help you, be more productive or be like a better person in relationships, to be able to communicate better and behave better in relationships that help facilitate and maintain those relationships. So this is usually done in an individual therapy format, usually starting with 2 weeks. Over time might go down to 1 week. And the length of treatment really varies depending on the person. It can go from 1.5 years to 4 years. So I just wanted to put some of the common schema modes that we see in BPD. One of these is the abandoned and abused child, which is related to feelings of worthlessness, abandonment and vulnerability, intense anger. For the angry impulsive child, there's intense anger, resentment, impulsivity, a sense of injustice, desire for control, and believe other people are to blame for their difficulties. And then on the other side of this, we have the punitive parent. And this is someone's self-criticism, self-blame, sense of inadequacy. And oftentimes this arises in response to another. We might be acting in what we would call the abandoned, abused child mode or angry, impulsive child mode. And then the punitive parent comes out and you start criticizing yourself and blaming yourself and telling yourself how wrong you are. And then to protect against all of this, there's the detached protector, which is someone who avoids close relationships, who becomes overly self-reliant, and not afraid of emotions for the most part. It's a belief that showing vulnerability is a sign of weakness. So you really might kind of completely pull back and be the opposite of showing your emotions. So in everyday life, there are a few things that you can do to kind of to weave some of these things into your life. So first of all, you can figure out what your own schema modes are. The Young Schema Questionnaire is available for free online, multiple places. This one link we have here gives you, a list of your different schemas in order of how often you use them, and gives you information about each one of them. And then once you know your schemas, it's really helpful to just be very aware, try to be mindful of when your schemas become activated. So pay attention, if a certain emotion comes up, if you're angry, maybe you're in the angry, impulsive child mode. And then you can keep a log detailing the experience itself. And you can talk about the emotions and the thoughts and behaviors that came up to. So I've also included a link to a free logbook of schemas that was available online that you can use to do this.
So I think for the sake of time, I want to make sure we have enough time for a question and answer. I think we're going to kind of not spend too much time on these last two treatments that we wanted to talk about. And in general, I'm going to just kind of overview the fact that while we've covered 4 of the more specialized treatments, which have often they're more comprehensive, they have a lot more components, they often take more time. There are other treatments out there that are what are called more generalized treatments or adjunctive treatments, which means they can be applied in many, many different settings. Many different providers can be trained in them, even if you're, let's say, a nurse practitioner or working in a primary care, like as a general practitioner, you can be trained in some of these approaches. And they can kind of wrap around or help with other basic treatments that people are in. So there are also these kind of adjunctive treatments that might involve a group or a form of therapy that you can add on to your kind of typical therapy as well and get some benefit for BPD symptoms and recovery. So I don't want to go into each of these in detail just for the sake of time. But just to kind of point out that there are other treatments out there that aren't these kind of full model, very lengthy treatments, but that can be kind of useful to be exposed to. Many of these treatments, like general psychiatric management or systems training or STEP, systems training for emotional predictability and problem solving, really have a heavy emphasis on psychoeducation or kind of teaching and informing patients about what BPD is, how to understand where it comes from, how to manage some of the basic symptoms of BPD. And they can be helpful as kind of add-ons or components of a bigger treatment program, or can be kind of added on as needed if you're kind of looking for more psychoeducation around BPD. So some of the things that we wanted to give in terms of resources on psychoeducation for BPD in particular, we just have a couple. This is not a comprehensive list, but definitely check out the NIA BPD website. Has a lot of, I think, very useful psychoeducation type resources on BPD that you can share with other people or read yourself. And there are others. And then there's a number of books out there that can be very useful in terms of giving you the perspective of what others with BPD have done or found helpful in terms of their process of recovery. We have one book here at Beyond Borderline, but there's many others out there as well that can be useful. And so make sure that if you're looking for kind of more psychoeducation on BPD, obviously, that there are resources out there as well. Anything you want to add to that, Alex? I'm glossing over this just for
no, we can go through.
Okay. I'm going to skip over these as well, and just move us, I think, to talking about some recognition of some of the barriers to receiving these treatments. I'm not going to go into each of these in detail, but obviously, even though we've laid out some of these empirically supported treatments that can be really excellent, and as Alex pointed out, a privilege if you're able to get into them, there's so many things that get in the way of us being able to have these types of treatments available. Our own ability to make time for it, to pay for it, other things that we're dealing with, comorbid, disorders like trauma or substance use, et cetera, that may, get in the way of some of these treatments working or being most appropriate for you. And so given that we recognize that these treatments aren't always available or accessible, we did want to mention briefly a couple things to think about when looking for therapy or looking for support that you can kind of keep in mind that we think will be particularly helpful to make that therapy work well for you if you're dealing with kind of BPD or the process of recovery from BPD. I guess I'll kind of jump in here. Alex, you can kind of jump in at any point.
I actually think that maybe we should skip over these. The slides are available. These are really helpful things to go through, but the slides are available and you can read them on your own if you'd like. I do want to get to the strategies to optimize recovery and say a quick thing about psychopharmacology for BPD. Okay. So there really is little to no evidence that psychiatric medication can treat BPD. There are no FDA approved medications for BPD. And research has actually even shown that the number of medications someone takes is associated in reverse with improvement. So it's inversely associated with improvement, meaning that the more medications you take, the less improvement you see. That we don't know the reason behind that, but that's just what research has shown. But medications might help secondary symptoms like mood symptoms or anxiety symptoms or other comorbid issues. But really, psychotherapy is what we know is the gold standard of treatment for BPD. Okay, so I put together some strategies to optimize recovery because treatment is so important, but just as important is what you do outside of treatment. So the first, and I think one of the most important pieces of recovery is increasing your willingness to change and to tolerate discomfort. So really, really making a vow to yourself that I'm willing, I'm fully in this, I'm going to do this even when it's difficult. Another part is focusing on building self-compassion because a lot of times you can become so self-critical and really a bully to yourself over time, especially when you're living with BPD. So there's a number of things that you can do to build self-compassion. I have recently really enjoyed doing a treatment and teaching a treatment called compassion-focused therapy, where you kind of really build your compassion itself. Also figure out what your strengths are and focus on those. Really, really start to think about the things that make you an awesome person instead of the things that you hate about yourself. and try to view yourself based on your strengths, even also acknowledging those things that you don't like about yourself. Another thing very important is creating structure in your life. When you don't have structure, you get really focused on things that might be, really create more emotional vulnerability to you. Having structure, engaging in things that are meaningful, activities that are meaningful to you, and then seeking out and nurturing supportive relationships that are reciprocal, and consider ending relationships that are damaging or interfering to you. Obviously, take care of your physical and health needs. And then something that's really very important is finding community. There are support groups, specifically through Emotions Matter has a number of support groups. You can find online like different forums or social media platforms, but what I would say is really try to focus on finding recovery-oriented ones, not ones that are more just talking about how miserable you are, but talking about ones that like what works for you and what's helping for you. Psychoeducation is huge. Learning as much as you can about BPD from both a clinical perspective and lived experience perspective. I've included some really helpful podcasts, YouTube channels, the BPD Bunch, which I'm a part of, which is a podcast and YouTube. The Borderliner Notes has really great also experiences from both clinician standpoint and lived experience. And then there's a really wonderful book called Borderline Personality Disorder Demystified, where you can learn as well. And then make sure to have resources and psychoeducation for your loved ones. All right, next slide. Is he frozen? All right, I had one final slide that said, what is that? All right, I had one final slide that basically just said, last thing I want to like impart to everyone is don't give up. Do not give up. Remember that recovery is not linear and is absolutely possible. Kimberly, you're muted. I can hear you, but it says you're off stage. I would say, I think it's absolutely important. There's so much good treatment out there, and I think combining different aspects to it can only enhance someone's treatment. There are some people who really feel very strongly about strictly sticking to their one model, but I definitely, my personal opinion is I think it's helpful to to kind of incorporate different aspects of different therapies. Yeah, it's a good question. I think there might be two pieces to it, because research never shows us the answer to the why to something. It shows the connection. So one of those things could be people who are on more medications might just have more symptoms. But on the other end of that, and this is the piece where I don't know how I feel about medication personally for it, is when you are taking medications, you are, in a sense, numbing certain emotions that you're having that need to be worked through. So, for example, if you're really anxious all the time and you're taking a medication that's getting rid of your anxiety, you're not able to work through that anxiety in itself.
It looks like maybe what we were saying, Kimberly, you and I was off stage. Some people might not have heard it. So we might have to come back to the IFS question or.
Yeah. Let's loop back to the IFS question. That's a good idea.
So one of the questions that multiple people have raised is whether or not internal family systems is helpful for BPD. And we were saying that though there's no real research yet on IFS for BPD, so we don't really know from an empirical standpoint, a lot of the principles of internal family systems are similar to some of the treatments that have been studied that we talked about. So for instance, transference focused psychotherapy has this focus on trying to kind of integrate or bring back together parts of ourselves that don't seem to kind of fit. So like the good and bad parts of ourselves, and trying to kind of bring them back into conversation with each other is very similar to the idea of in internal family systems of having the different parts of ourselves kind of dialogue or kind of work together to create a more coherent whole sense of ourselves. So I could imagine that there's some ways in which that approach is definitely relevant for BPD, even though it hasn't been studied yet.
We have a question about kind of the aftercare after like a DBT or another intense program, in terms of like recommendations for like how much therapy afterwards.
There's DBT grad groups at a lot of places. They do where they're kind of more led by patients themselves. It just kind of keeps you accountable and using skills and practicing skills. But otherwise, just kind of keeping yourself involved in a way, keeping yourself in check and noticing when symptoms might pop up again. If you don't want to continue with the DBT therapist, you can always start with another therapist. And you can try, if you still feel like symptoms are present in your life, you can try a different form of therapy. It can even just be regular supportive therapy as well.
Yeah, I will add to that one of the things we hope that you take from this is that if one treatment doesn't work, DBT or whatever it is you might start with, don't give up hope. There are other types of treatments from very different perspectives, and you may have to spend some time and energy trying to find a therapist, but there are different approaches, and knowing that I think can increase the chances that you'll find something that will work for you if you keep trying. So I think that's just important to keep in mind.
There's another question about asking if you guys could speak to the shortage of professionals who offer these treatments, especially like in case of mentalization, and also that even the good providers often don't accept insurance or don't do the between appointment phone calls.
Yeah, there's a number of different reasons that is still a problem globally, that there's not enough access to these treatments. One of the reasons is there's not enough education in even in training programs like doctoral programs or other programs about what personality disorders are, how to treat them. And so people aren't being exposed to this type of information. And so they go on and then they don't learn kind of specialized treatments because they just don't know kind of about personality disorders or BPD. I think that's an unfortunate problem. And then I think insurance companies often, as someone had mentioned in the questions, don't often reimburse for some of these treatments, which is still a problem that advocacy groups are trying to tackle and to get some of these treatments more insurance reimbursed. So DBT, many of the DBT providers have been successful in trying to get some aspects of DBT insurance reimbursed. And so it's still a work in progress to kind of change some of the systems that are in place that make it hard to get access to these treatments, unfortunately.
All right, on behalf of Emotions Matter, I want to thank the panelists for sharing and for this very insightful discussion. Thank you for all the attendees and for your questions. We're sorry that we could not get to all of them. If you have individual questions that was not answered, you can always connect with the presenters in the People's Profiles Engage button on the left-hand side of the panel. Thanks.
Thank you.
Thank you all.